Bismillahirrahmanirrahim. Quote of the day. Better than 1,000 days of diligent study is one day with a great teacher. I am Dr. Alishba Rasool and I will be presenting the critical appraisal of a journal article under the supervision of Professor Dr. Saira Afzal. For my critical appraisal, I will be using the Prisma checklist. This is the checklist given below. It is a 27-item checklist. The checklist for the abstracts is given below. This is the title, Factors Contributing to Cervical Cancer Among Women, a Systematic Review and Meta-Analysis. Abstract. Cervical cancer is among the top 10 most common cancers worldwide, and it is the third most common malignancy among women in Pakistan with a reported incidence rate of 5.98. Unprotected and early sex, low socioeconomic status, early menstrual cycles, multiparity relationships, HPV infections, co-infections, hormonally changed immune system, smoking, and low education level, among others, are all risk factors associated with cervical cancer. Objective. The targeted objective of this review and meta-analysis was to identify how comprehension and attitude may impact on how frequently women utilize services for cervical cancer screening. Methods. The review of the literature was done using a variety of resources, including Google Scholar, PubMed, Medline, and other databases. The keywords: incidence of cervical cancer in Pakistan, prevalence of cervical cancer, and risk factors of cervical cancer in Pakistan were used. Results from this literature review: following factors has been identified that are affecting cervical cancer development: sexually transmitted infection, multiple sexual partners, marrying before the age 18, multiple childbirths, oral contraceptive pills, smoking, obesity, nutritional and dietary factors, and low socioeconomic status. Conclusions. The burden of cervical carcinoma has increased as a result of the rising prevalence of the condition. Although Pakistan has a lower prevalence of cervical carcinoma than other Western nations, mortality rates are high as a result of inadequate awareness, poor follow-up, and late presentation of cervical malignancy. Firstly, we will be critically appraising the title and abstract by applying the abstract checklist. It does identify the report as a systematic review, provide an explicit statement of the main objective. It does not specify the inclusion and exclusion criteria. It mentions the online databases and keywords used to synthesize results, however, does not include the date when each was last searched. It does not mention the methods used to assess the risk of bias in the included studies. It does not mention total number of included studies and participants. Mentions the results for main outcomes but not indicating number of studies and participants for each. Does not provide a brief summary of limitations of evidence included in the review. Provide a general interpretation of the results. Does not mention the implications. Does not specify a funding source. Does not mention the register name and the register number. Introduction. Cervical cancer is among the top 10 most common cancers in worldwide. It is the third most common malignancy among women in Pakistan with a reported incidence rate of 5.98%. It has been noted that few middle and low income nations have high rates of cervical cancer screening tests. Statistics show that compared to low and middle income countries, high income countries have 3 times higher screening rate for cervical cancer. Many low and middle income countries believe that a number of issues such as women's aversion to testing and a lack of understanding about the disease risk factor and treatment choices are to blame for the low uptake of cervical cancer screening tests. For the development of successful strategies, the use of cancer screening tests is required. However, the goal of the systematic review and meta-analysis was to determine how knowledge and attitude may impact how frequently women use services for cervical cancer screening. Methods. Between March and April 2022, 5 electronic databases, Medline, Embase, Niles, Corpus, Web of Science were searched, and a second search was carried out in June 2022. The inclusion criteria included all primary source and peer-reviewed reports on factors contributing towards the cervical cancer among women. The review included all the literature from 2012 to 2022 to capture all the work that was written in English language and reported during this period, and all other work that did not conform with the above requirement and those which are not written in the English language were excluded. The data was analyzed using the content analysis approach with the data acquired from all these records serving as the unit of analysis. The main risk factors for cervical cancer in women are STDs, multiple sexual partners, marriage before the age of 18, multiple pregnancies, oral contraceptives, use, smoking, obesity, and low socioeconomic position. Infection with high risk for oncogenic HPV strains is the main contributor to the precancerous and cancerous cervical lesions. Moreover, 8 records, including real literatures, were included in the review as summarized in the table. 8 factors emerged: sexually transmitted diseases, multiple sexual partners, marrying before the age of 18, multiple childbirths, use of oral contraceptives, smoking, obesity, nutritional and dietary factors, and low socioeconomic status. The following 8 studies, which were included in this systematic review, are summarized in the table. Discussion. Cervical cancer is a public health issue as there is a greater prevalence and mortality rates of cervical cancer in reproductive age women from lower socioeconomic strata. It is the main factor in the female morbidity and mortality. There are several factors that contribute to the advanced state of the disease when it is presented, but ignorance is still the biggest one. According to a cross-sectional study done at 3 hospitals in Punjab, Pakistan, impoverished people and persons who resided in rural regions were more likely to develop cancer. The majority of studies demonstrate that having more stable partners and beginning sexual activity at a younger age increases the risk of cervical cancer. Through a number of ways, smoking can raise the risk of cervical neoplasia. The risk factors and screening procedures for cervical cancer are also poorly understood by women from low socioeconomic backgrounds, and those who are poor do not get screened for cervical cancer, such as pap tests. They are unaware of these health services, and some people disregard the symptoms. Conclusion. Pakistan has a lower prevalence of cervical carcinoma than other Western nations. Mortality rates are high as a result of inadequate awareness, poor follow-up, and late presentation of the cervical malignancies. Implementing a countrywide screening program and improving public health education are required for late-stage diagnosed condition in order to save Pakistani women's lives. The analysis, ideas, and concepts are now provided as findings that might have an impact on the policymakers, government, and non-governmental organizations. Applying the Prisma 2022 checklist on the above article that I've introduction, it adequately describes the rationale of this review. It provides an explicit statement of objective for this review. Methods specifies the inclusion and exclusion criteria, specifies the databases, registers, websites, reference lists, and other sources searched to identify studies along with dates when last source was searched. Present the full search strategy for all the databases, registers, and websites. Specifies the methods used to decide whether a study met the inclusion criteria for the review. However, does not mention how many reviewers screened each record, whether they worked independently, or if any automation tools used. Does not mention the methods used to collect the data from the reports, including how many reviewers collected data from these reports, whether they worked independently, any processes of collecting or confirming data from study investigators. Does not list the outcomes for which the data was sought, does not list the variable for which the data was sought, participant intervention funding, does not specify the methods used to assess the risk of bias in the included studies. It does not describe any process used to describe which studies were eligible for each synthesis. It does not describe any methods required to prepare the data for presentation or synthesis, such as handling of missed summary statistics. Does not describe any method used to tabulate or visually display results of individual studies. Describes the methods for data analysis. Does not describe any method used to synthesize the results. Does not describe any method used to assess the heterogeneity among the study results. Does not describe any sensitivity analysis used to assess the robustness of the synthesized results. Does not describe any method used to assess risk of bias due to missing results in the synthesis. Does not describe any methods used to assess certainty in the body of evidence for an outcome. Results does not describe the results of the search and selection process from the number of records identified in the search to the number of studies included in the review, ideally using a flow diagram. Does not cite the studies that might appear to meet the inclusion criteria but were not included and explain why excluded. It mentions each included study with its characteristics in the form of a table. Does not present the assessment of risk of bias for each included study. Does not present each study for each outcome. It does not briefly summarize the characteristics and risk of bias among contributing studies for each synthesis. Does not present results of all investigations of possible causes of heterogeneity among study result. It does not present results of any sensitivity analysis conducted to assess the robustness of the synthesized results, does not process assessment of risk of bias due to missing results for each synthesis assessed, does not present assessments of certainty in the body of evidence for each outcome assessed. Discussion provides a general interpretation of results in context of other studies, does not describe any limitations of the evidence included in the review. It does not describe any limitations of the review processes used. Discuss the implications of result for future research and policy. Other information does not provide any registration information, does not indicate where the review protocol can be accessed, does not mention any financial or non-financial support or funding for the review, does not declare any competing interests of the review authors, does not declare where the following are publicly available and where they can be found: template data collection forms, data extracted from included studies, data used for all analysis, and other materials used in the review. Strengths. Title is concise and identifies it as a systematic review. Rationale is adequate. Objective is mentioned. Specifies the inclusion and exclusion criteria. Specifies the databases used to identify the studies along the time period. Presents the full search strategy. Specifies the method used to decide whether the study met the inclusion criteria. Mentions the method for data analysis. Mentions each included study with its characteristics in the form of a table. Mentions its implications. Weaknesses. Does not mention the methods used to collect data from the reports, including how many reviewers collected data from these reports. Does not list the outcomes or variable for which data was sought. Does not mention methods used to assess the risk of bias in the included studies. It does not describe any processes used to decide which studies is eligible for each synthesis. It does not describe any methods required to prepare the data for presentation or synthesis, such as handling of missing summary stats. Does not describe any method used to tabulate or visually display results of the individual studies. Does not describe the results of the search and selection process from the numbers of records identified in the search to the number of studies included in the review, ideally using a flow diagram. Does not cite the studies that might appear to meet the inclusion criteria but were not included and explain why excluded. Does not mention the assessment of the risk of bias in each included study, does not describe any limitations of the evidence included in the review, and it does not describe any limitations of the review processes used. Thank you.
Thank you so much, Dr. Alishba. It was a nice presentation, briefly explained, and your time management was very good. However, I would like to add few points to this review. This was a systematic review and a meta-analysis, as the title says. So the title is identified as a systematic review, but some of the points were not very clear in the title, like factors not very clear in what age groups were focused, and no geographic area was also mentioned in the title. And coming to the abstract, it was unstructured abstract with the basic requirements of background, objective, and all the headings were there. But the one thing that was very prominent, that the title, the objectives were not in line. And also the results that were mentioned in the result section in the abstracts were not in line to the objectives that was mentioned in the abstract section. And the conclusion of the study was not also very strong. So coming to the introduction, the scientific background, they have tried to explain the scientific background of the study and how the factors affect the cervical cancer and the knowledge and attitudes, but the rationale does not clearly mentions how the utilization of cervical cancer screening services is addressed and how they are measured, and they are not clearly addressed in the rationale part in this context or context of Pakistan, and how it is measured and how it will be considered in for this study. For method section, as it was clearly seen that the Prisma flow sheet diagram, that is the basic for the pictorial representation of all the methodology of study selection and data extraction was missing. So it was a main point. There were some grammatical mistakes identified as well. Like one of them was data was presented or analyzed. It is should be data were. Next is the individual role of the authors, as you have mentioned, was not given who did what, and the conflict of interest and registration numbers were not mentioned. Results are simplified but not pictorially represented, no forest plot. And the results that were only given in frequency and percentages does not justifies the use of the term used for meta-analysis. No statistical analysis was done, no meta-analysis was done, and therefore no quality assessment of studies was done, and then no mention of any kind of statistical analysis, and no sample size was mentioned. So it was a simple review reporting the different frequency and percentages of different factors that were observed from the different studies, and the objectives and the results and discussion were not in line. And by only reporting the frequency and percentages, the authors cannot justify the use of the term meta-analysis for this whole review, and the results were not conclusive. As you can see that the whole paper was not in line to the objectives. So it could have been a good general review if they would have not added this systematic review and meta-analysis, but all the points that are needed to be for a good systematic review and meta-analysis were not met adequately for this review. So there are several things that could have been added to strengthen this review. This is all from my side. Now the house is open for discussion. Thank you. Anybody who wants to add anything or ask anything, because we have some time left in this meeting. Okay, if there are no questions, Dr. Alishba, do you want to ask anything relating to your article, or you're fine?
No, I'm fine.
Okay, thank you so much. It was a
Okay,
nice presentation.
Allah Hafiz.
Allah Hafiz.